Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we've got West Tennessee Healthcare updates with our very own Amy Garner. Welcome back, Amy.
Thank you.
This is our second series on this topic.
It is. Great to be here.
Great, yes. So Amy is our Chief Compliance and Communications Officer here at West Tennessee Healthcare. And so we're starting this, we started back in October, and now we're doing our November edition to kind of just fill people in on what's going on around West Tennessee and all that we've got going on here. So I know we had a big month. October was a huge month. So we want to kind of cover some of what happened, recap some of what happened in October.
That's right. We had an incredibly busy month in October. I've shared this with a lot of audiences lately, but October, I think, may be one of the busiest months that I ever remember being in the system. For example, we hosted a breast screening and screened over 100 uninsured women on Saturday, October 26th. And that's because October is Breast Cancer Awareness Month. We also have celebrated heart patients with a reunion with their care team this past week, and I just had some beautiful stories from patients across West Tennessee who were treated by not only our team here in Jackson, but were treated in some of our community hospitals like Dyersburg as well. And it just shows the importance of how our community hospitals are able to provide continuity of care all across the region, and then connected to our larger hospital with specialty care here. And we just had some great outcomes with our patients. And of course, you all may have heard by now that our heart team, our heart and vascular team, is the #1 team in the state in terms of quality and in the top 6% in the nation. And so we're very proud of that.
Exactly. Yes. It's such a great achievement.
It is. And in addition to all of that that we had going on, we also had our big electronic medical record conversion to Epic October 4th and 5th. And so that work has been going on for a year and a half now, but we had a successful implementation. Of course, not without some hiccups here and there, but our teams have done an incredible job. Probably over 700 employees have worked on that project for a year and a half, and just an incredible amount of work, plus all of the support areas that have supported those teams, like security and food service and lots of others. I'm going to leave somebody out, but if you are a patient of West Tennessee Medical Group or a patient of any of our hospitals across the region, you can download the app for the electronic medical record. It's called MyChart, and you can communicate with your provider. You can get medication refills, schedule appointments, all sorts of things. And so it's going to be great for our patients across the region.
Yes, and I will be adding that link to our show notes. So if anybody wants to check that out, if you haven't already, it's great. I have it. And one time I went to urgent care. I actually went to the Lyft clinic, and I was getting tested for the flu and strep, different things. And while I was sitting in the room after they had taken the test, I got an alert on my phone saying your test results are in negative. And then a few minutes later, the provider came back in and said, okay, you're negative. But it's funny because I found it out right before they came back. So you're not just sitting there wondering.
Yes,
you get those results as soon as they enter them in.
That's exactly right. And over the weekend, I sent my provider a request to refill a prescription. And first thing this morning, my refill was on its way to the pharmacy.
It's just like that. You don't have to wait on the phone.
Fast. Yeah. Yes, it's great. And speaking of our medical group and our providers, we are so happy. And we thank everybody who voted for our providers in the VIP Jackson Magazine's Best in Jackson awards. We had so many winners, and we're so proud. For example, Buffy Cook was voted Best Doctor. He's at our Thompson Farms location. Lift Therapy was voted Best Physical Therapy. Dr. Grant Studebaker, who's with West Tennessee Medical Group University Medicine, was voted Best Primary Care Physician. Dr. Frank Pierce was voted Best Women's Health Provider. And West Tennessee Medical Group was voted Best Medical Group across the region. Yes. So we are so proud of all of those folks that were that were voted best of the best. And thank you to everybody who voted for us.
Yes, exactly.
In addition to everything else that I mentioned about October, we had a successful Alzheimer's Caregivers Conference, which I believe is an annual affair and always has a great turnout. Regina Smith and her team and our senior services department always is great for providing resources for those who are dealing with Alzheimer's patients. And our Hope and Healing Foundation. Listen, if you did not go to the first Sip and Savor soiree at the farmers market, you missed an incredible night of food and fellowship and fundraising. It was such...
I didn't get to go, but the photos, so the photos that they took, I mean, of the food that was there and all the vendors, I mean, it looked like a blast.
It was a blast.
That's definitely going to be on my list for next year.
Yes. It's just going to get bigger and better. Donna Steins and the whole team that put that together, a bunch of volunteers. It was just an incredible event. It was well done. The weather, was just fabulous. And we had a great night. It was a very casual event.
Right, yeah.
So, and the food was great. So I hope everybody will put that on their calendar for next year because it's just going to get better and better.
And like you said, it was the first Hope and Healing Foundation event that they had done.
That's
since being
right.
implemented. And I think, what did she say that they earned? It was like,
I don't know the total dollar amount, but I know we sold, 300 plus tickets to the event, and it was just so well done. The team just outdid themselves. I couldn't believe how great it was.
I know this wasn't just from that event, but Donna let me know that to date they have raised $128,000 to support the Hope and Healing Foundation.
That's fantastic. And if you don't know anything about the Hope and Healing Foundation, you can go to their website and learn about what we're raising money for. I believe it's Hope and Healing Foundation.
WTHHopeandHealing.org.
Thanks, Kara, for correcting me.
This is me checking their Facebook page.
Yeah, so. Yeah, they are currently raising money for a new hospice home, which is a residential hospice. We don't have one in the region outside of Memphis or Nashville, so it's a real need in our community, and that's one of the things that we're raising money for. But but we have a lot of work to go to raise money for that facility. Speaking of hospice, November is Hospice Appreciation Month. Yes. And so Hospice of West Tennessee is part of West Tennessee Healthcare, and they are offering some grief support group meetings now, the first and third Tuesday of each month. And if you are dealing with grief and maybe the loss of a loved one, or even, just during the holidays, if you just need a little bit of...
Grief during the holidays is rough, yeah.
It is. And yes, and sometimes, we're triggered during the holidays thinking about loved ones that aren't here anymore. And if you need a little extra support, you can find out about that by calling 731-664-4220. And you can get in touch with our hospice team, and they can let you know what times those support groups are.
And they have free resources that you can gather from them. We've had a few people on the podcast to talk about. We've had some hospice nurses. We've had some people who help with the grief counseling. So I'll share those as well in this podcast.
Yeah, so that's great. That team is I think of those folks as angels.
Yes.
Because they have incredibly hard jobs, important jobs, and we just applaud them for everything that they do for our patients and families in those last days. That's a tough situation.
Right.
We also, I forgot to mention, but it's really exciting. We just took on Henry County Medical Center and all of their providers. We took on that hospital and those clinics October 1st, and we will be having our ribbon cutting on Thursday, November 7th at 2:00. They're in Paris, Tennessee at the hospital. And we are so excited about their system coming alongside ours and preserving healthcare in that region because that's a large market, and we do not need another hospital to close here in Tennessee. And so we're very happy to have that team on board with West Tennessee Healthcare, and we'll be celebrating them on Thursday.
Great, yes. And I know, October, we had so many events. So we had first Sip and Savor event. We had the 13th annual Alzheimer's Caregivers Conference Kirkland Cancer Center did the breast cancer screening, and our GYN specialist clinic had their first girls' night in. So they did kind of, they've got the new 3D mammo there, so that was very exciting. We had Paris had their Zoo and Boo Halloween thing. So, I mean, there was just so many events that we were doing, and so we were excited to get on that. I know the EMS team also volunteered to help in East Tennessee.
They did. We, as a matter of fact, I went over to an event last Friday at the Jackson-Madison County Health Department, and Senator Ed Jackson and Brandon Ward with the state EMS office recognized our first responders from Madison County, along with Decatur County's EMS and Madison County Fire Department, the Office of Medical Examiner, Madison County Emergency Management Agency, and a large team of our medical center EMS crew, and probably some others that I'm leaving out, but they all have a strike team and participate, and they go and are deployed to areas where they are needed. And so that team went over to Unicoi County in East Tennessee to help with the flooding victims over there. And I think, if I'm not mistaken, they transported over 200 patients during their deployment, helped rescue some folks. And so it's just amazing the work that they do. And we don't often realize it, but West Tennessee Healthcare, when we grant them permission to go and help elsewhere, that leaves our team short here, but everybody steps up and makes those services work while we're supporting those teams that are deployed in other areas. And we are just so proud of the work that they do.
Exactly. Right. Yeah. Because, it's a community. And, this is the West Tennessee community, but,
they're Tennessee. They're our neighbors and families. And, they could go to Florida. They could go to, other hurricane ravaged areas. But this time it was over in East Tennessee. And we're just really proud of all that they do for us.
Exactly. Like, I can't imagine going into that people are like, stay away, evacuate. And these people are the ones that go towards it.
That's
so
right.
that's such a thing to admire and appreciate.
It is.
Efforts.
Those folks, I'm not clinical at all. And those folks that take care of our patients and especially do those types of jobs are just heroes.
Right,
That's all you can say about them.
Speaking of
heroes, let me mention that November 11th is Veterans Day, and Monday we will be having a very special celebration for the veterans that work here in our system. We're going to start that morning out at 7:50 with a flag raising. And that will be at our patient discharge entrance. And then we're going to have a very special program for our veterans in J. Walter Barnes Auditorium here in Jackson. And we're going to celebrate all the veterans that we have that work in our system, plus our patients that are veterans as well.
Right, yes.
So we always look forward to that every year. It's always a great program. And we have a lot of veterans who work in healthcare. And we're so proud of them. They are a special group of people for sure.
Yeah. Also, so this November, we've got coming up on the 9th, they're going to be doing a lung cancer screening with Kirkland Cancer Center.
Saturday lung cancer screening at the West Tennessee Imaging Center.
Imaging Center, yes.
And I heard last week that we still had a few slots available for that. And that number to call is 731-541-1742, if I'm not mistaken. But we'll make sure that we put that link in the program notes. And so if you're 50 years of age or older and you have a history of smoking, that lung cancer screening is just for you. And like I said, we've got slots available, so those will fill up quickly, but it is a low dose CAT scan that they will do. And early detection is always best when you're dealing with any kind of cancer or chronic condition. So get over there and get your lungs screened. And speaking of screenings, it's not just lung. You need to have your mammogram. You need to have your prostate screening if you're male. You need to go ahead and be getting those flu.
Even if you're not,
those flu shots, those COVID shots, all the vaccinations that are available now. It's getting to be that time of year.
Yep.
So it's time for those shots.
Yep. And then I know it's in terms of lung cancer, we just brought in 6 new, I think we mentioned this last time, but we have 6 new pulmonologists at our new pulmonology clinic. It's at the same building. It just took over a bigger section.
That's right.
On Skyline right in front of the hospital. So
that's right. And they're taking new patients. So check out West Tennessee Medical Group Pulmonology, and you can make appointments there by calling the number on our website.
Yes.
That's WTH.org.
Yes, and then, Thanksgiving's coming up on the 28th. I can't believe it.
I
We've
can't
got
believe
2
it
more
either.
months to the end of 2024.
It's November. That's just crazy.
Yeah, and then we're still looking forward to celebrating our 25th year of having the Jackson-Madison County Hospital here. So that'll be next year.
75th year.
75th. What did I say?
25th.
I'll say, you know what?
Been
We'll
here a
just cut
little
that
longer.
out and I'll just put 75th in there. Yes, we're having our 75th anniversary of Jackson-Madison County. So that'll be an
That's
exciting thing
right.
for 2025.
That's right.
Yes.
Can't believe
It's
it.
2025. That's where I got the 25.
Oh, yeah. That's
In
right.
2025, Jackson-Madison County will be 75 years old. Yes. Well, all right. Well, that is a lot going on, and we're excited about all the things that happened in October. We're trucking right along to the holidays here.
That's right.
And yeah, we just want to say, well, we'll go ahead and just say Happy Thanksgiving to everyone
and
here.
Happy holidays.
Happy holidays, yes. All right. Well, thank you so much for coming by and
Thanks for
sharing
having
all
me.
this info with us. Thank
I
you.
appreciate it.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.